Welcome to Connecting Citizens to Science, a podcast from the Liverpool School of Tropical Medicine about engaging communities in global health research. I'm Kim Ozano.
And I'm Bea Egged, and throughout this series we'll be talking to researchers from around the world, exploring how they connect with people to address a range of challenges in global health.
Hello listeners, and welcome to the Connecting Citizens to Science podcast. This month's series has been all about promoting social change with communities and people living and working within urban informal spaces. Over the last 3 episodes, we've learned a lot about how researchers and scientists and supporting organisations connect with communities and people in urban informal settings so that change can be instigated and health and well-being can be improved and governance actors can be held accountable. What we've heard less about is how the research methods such as photovoice and creative methods and the data collection from working with communities is turned into action. So we have the pleasure today of connecting with our co-host Robinson Karuga to hear more about that. Hello Robinson, it's been an absolute pleasure to co-host with you over the last 3 episodes. And now we have a chance to understand your own experiences as from being part of the Arise project, working with urban informal settlements and the communities and people that live there to improve accountability for health and well-being. So we're quite keen to hear from your side of things, and we've not had a co-host as a guest before, so this is brand new. So let's start by saying hello. I hope you're well today. And then just remind us of the work you've been doing around photovoice that we heard about in episode 1. And let's explore a little bit about your involvement and how that work has moved forward.
All right. Thank you very much, Kim, for having me again. It's been a very rich journey since the last time we had this podcast. So today I'll share with you the steps that we took after the photovoice and how that's going on. But first, let me just do a very quick recap of how we started the photovoice journey. So we started by working with community groups and governance actors in 2 urban informal settlements in Nairobi, where we brought together, a team of governance actors and community members themselves to collaboratively identify groups that are most vulnerable and marginalized in the informal settlements. So after much deliberation and participation, 3 groups were agreed upon through consensus by within both informal settlements. These were older persons, persons living with disabilities, and children heading households. So after that, we worked with community health volunteers who who know these settlements very well and helped us to identify participants who would take part in this particular exercise called photovoice. So once we selected participants in these 2 settings, we also got co-researchers in one of the settings and empowered them on how to use phones for photography and how they can tell their stories using photographs, and also really emphasized on ethics in photography and safeguarding. So once we had the photos going, we would occasionally pop in to just provide supervision and just provide any support if our participants and co-researchers needed any, and we would have weekly sessions where they would discuss the themes of the photos they took for that week. So for example, in the first week they'll take a photo on what does marginalization look like and how do they feel about these marginalizations on that they experience on a day-to-day basis. And in the 3rd week they would probably take photos and talk about what recommendations they have for governance actors to resolve their day-to-day experiences of marginalization. So it's been a very intense and rich journey in this photovoice, and I'm glad to say after that we were able to share the findings of this photovoice exercise with governance actors and I'll be happy to take you through that exercise in the next few minutes. So yeah, so that's a very quick recap of how we did the photo voice.
That's great. And thank you for helping us to understand that. And it's really interesting that you brought governance actors and community together to try to understand those priority groups and the efforts that you went to make sure that you really were reaching the people that quite often didn't have a voice. We've heard throughout the series of Connecting Citizens to Science a lot about the methods that are used to capture stories, but we haven't heard much about what happens after that. How does it instigate social change? So once you collected the data and analysed it, what happened next?
Oh yeah, this is one of my most memorable points in the photo voice research. So after we shared the findings from our analysis with the governance actors and the community members, so we used those particular sessions to discuss, what the key issues that they would relate to based on the photo voice exercise, and how would they go about prioritizing or picking the most important or the most urgent issues. So after showing or sharing the photo voice feedback, and this was done by the participants themselves, those who had taken the photographs, we went through them together with the community members, and they listed about 10 key things that needed to be addressed within within their settings. So from those 10 things, we again partnered with the community members and the governance actors. And then just to be a bit more specific, those who participated in this exercise were the participants who took the photos. We invited civil society organizations that work in the informal settlements. We worked with community-based organizations that had addressed specific issues within these informal settlements. We brought in the chief and the village elders and a few community health volunteers. So I would say that one of the priorities that they identified was mental health, and that came up from all the discussions around the photos that had been taken by our participants and the core researchers. So once we all agreed on what on mental health, because that was the biggest priority for them, we again now asked them to help us identify who would be best placed to address some of these issues. So again, working with the community level governance actors and the community, we identified a team within the community that will drive this agenda forward. The term that we're using at the moment is a term that we borrowed from quality improvement practices, and we are calling them work improvement teams at the moment. So uh, the community members identified a work improvement team, which also includes some of the participants who are marginalized. So it was very interesting because the participants were able to share their voices using photo voice, and now here they are at the table prioritizing and addressing the challenges that they identified through photo voice. So one of the key things that we did, or we worked with the community members to address this priority, which is mental health, was to conduct what we call a root cause analysis. And again, we worked with them to enhance their capacity on how to do the root cause analysis. And here we use what we call the fishbone technique. Using the fishbowl techniques would identify what are the bottlenecks and what are the main challenges around mental health. So some of the key things that came up were, we didn't have a curriculum for mental health, or rather, they were not aware that there was a curriculum for mental health at community level. The community health volunteers did not know how to identify mental health issues or where to refer to. And another key thing that came up was they didn't have any health information management tools to capture any data related to mental health. We then worked with the police, because the police were also invited. And, when they listened to the discussion, they realized, maybe some of the crime issues they were dealing with, such as violence, would have been triggered by mental health challenges. So we also identified with the community members, the police as potential recipients of sensitization on mental health. So we worked with the community members and the sub-county level health managers to identify uh, facilitators on mental health from the Ministry of Health who came to the site and sensitized our community health volunteers and primary healthcare workers on how to identify, record, and refer community members who are experiencing mental health challenges. So, it was really fascinating to see that trajectory all the way from photo voice to problem identification, root cause analysis, and now they're actually implementing and delivering mental health solutions in the informal settlement. So our main role here as a researcher is to provide coaching on how and providing technical support on how to go about the referrals for mental health and just giving them moral support as they go about this. Let me also mention that we, using photovoice again, we worked with a sub-county level health management team, which is also a very key resource for for addressing some of the mental health issues that were identified. So we're also working with them as a work improvement team, so that they're able to again monitor and use health records for making decisions for addressing mental health issues. Yeah. So it's still unfolding and very interesting and rich journey that we are going through, and we're also learning a lot through this process. So, great question, Kim.
Thank you so much. I was trying to write down all the different steps in this process. It's quite easy to understand, but I can imagine there was a lot that had to be thought about in order to implement it. I wonder if I could ask you, in that workshop where you had these extremely marginalized populations come together with governance actors, civil society, chiefs, village elders, and even the police, how was their confidence in that setting to share their stories?
Yeah, so initially, and this is natural, we identified a bit of power dynamics at the beginning of the workshop, but then we use some power, so we use some approaches that sort of balanced, or we made sure that people left their identities and their power conceptions, or how they perceive themselves outside the door. So we used a power analysis technique, and that way we're able to now talk as peers, because once you have the participants and the local chief and the police, power issues play out. So power dynamics was the very first thing that we had to address in this meeting. But of course, it took a while for our participants to be able to speak out. So I would say that was the second level of this process, where initially they were not able to speak out, but then with time, as we continued engaging, they were able to again get a voice. So I would say it's a process. That's one of the key things that we are learning. Empowerment and participation of marginalized persons in governance is not an end in itself, but it is a social process. Of course, taking into account the context, taking into account the power dynamics and the different actors that they're dealing with.
Thanks very much. And it's useful to know that you have considered power in the process. And a project that uses this participatory action research type approach, or quality improvement approach, is so important to consider power as well. It sounds like you've learned a lot through the process. Could you share with our listeners some of the main learning points that you've discovered from going from that data collection to presenting it, priority setting, right up to developing this brand new intervention?
Oh yeah, one of the key thing is I've learned things about sustainability. You know, how I've learned how to be able to promote sustainability of these accountability processes. And one of the ways of establishing this is to work with already existing governance structures. So, in the informal settlements that we're working on in Nairobi, we did not establish or did not work with government actors to establish new work improvement teams. Instead, at community level, we brought in existing actors such as the local chief, the elders, and after addressing the power issues, we were also able to incorporate these marginalized persons, and that has really helped in giving a voice. And we know even after the end of a project, this 5-year project will be able to sustain that, because now the key issue here is how do we embed some of these practices, or practice of governance actors incorporating the voices of those marginalized people. So strategies for sustainability is a key lesson for us, because even at subnational level, what we call the duty bearers, we worked with existing health management teams, say, for example, addressing mental health issues. So that way we know even if the project ends, this structure will remain beyond Arise, and we'll continue with some of these initiatives. The second key thing we learned is that we have to be adaptable when we are working in informal settlements, because sometimes as we were addressing the priorities, so say for example mental health, one of the key things within mental health was alcoholism, and we have to be very careful, not because as we're dealing with this problem, of as we're identifying some of the priorities, we noticed we may have, you know, inadvertently, knowingly, or, or we may have inadvertently um, created enemies in quotes, or interfered with other people's confidentiality, their privacy, and for some, their livelihood, because there are those people who sell alcohol for as a livelihood. So we had to be very sensitive about how we frame some of the issues and how to approach some of the solutions that we identified. So framing, we have to be very adaptable when we are framing problems and solutions, and let this come from the participants, but also for us, we also help in framing how they communicated them. Then this, what I'm about to say, is one of the most important to me, because the concept of inattentional blindness came up very strongly, where we see the marginalized and vulnerable people are hidden in plain sight. So I must commend the government, or the Nairobi Metropolitan Services, for investing a lot in terms of water, building roads, building hospitals, setting up lights. But then all these investments are done, but the marginalized and vulnerable people are still invisible. So we focus on some of these big solutions, but then we do not see these child-headed households, or that these children-heading households. We do not see the persons with disabilities, or even the older person. So say, for example, there's so many new roads within the informal settlements, but then there are no provisions for people with hearing impairments, or people who need to use wheelchairs or crutches. So they are very good investments, but then we do not see the marginalized people. And I saw photovoice as a very critical approach for giving governance actors, or rather giving the participants a voice, to be able to speak out and shed some light that will reduce this inattentional blindness. So I would say I'm a bit more conscious now as a result of participating in photovoice, conscious about the plight of these marginalized people. And yeah, I see myself uh, being able to incorporate some of these sensitivities or being more conscious whenever I'm participating in any planning or working with government to address some of these things. Because again, there are a lot of intersections between the things that exacerbate marginalizations amongst the groups that we're working with. So, but that's another whole story, and I believe we may have another podcast to talk about intersectionality. Yeah, but let me pause there for now, Kim.
Thanks, Robinson. That's a wonderful, really comprehensive answer and some key lessons learned there. And I think one of the first ones is to use the structures that are available and to build on those. When you talked about the connections you had with duty bearers, as an organization, LVCT, did you already have those connections, or did you have to make them new and kind of seek out new relationships in order to move the project forward?
So for me, I would say for the longest time we've worked mainly in the health sector. So we had a natural connections with health management teams, but then as a result of Photo Voice, we are now able to build new relationships with governance actors who we were working with very indirectly in other engagements at community level. But right now, I'm glad to say we've formed new networks, and yeah, we've really learned how to work and understand each other, and basically how to frame issues to address things that are not necessarily uh, directly related to health, but then we are also now dealing with broader issues in society that also affect health and well-being, both directly and indirectly. Yeah, so yeah, we've gotten a chance to make new friends and build new networks with governance actors.
That's really great to hear. And I think for our listeners, sometimes there's a lot of concern about how you kind of connect people with governance actors once research has taken place so that action can come out of a research process. And it sounds like there's been a lot of cross-sector learning as well. Just as we come to the close of this podcast, I would like to understand a little bit about your own personal learning journey through using this kind of progressive research and how your research with extremely marginalized, vulnerable participants has impacted you on a personal level and in relation to your career as well.
Oh yeah, that's a, a question that has made me really reflect and look within myself. But I would say I'll come back to the inattentional blindness issues again. Um, One of the things that has changed me as a person would be to be more sensitive and conscious about some of the things that or the factors that make marginalization even worse. One of them I would say is the effect of generational poverty. So I've really come to see how that uh, exacerbates marginalization across generations. The other thing would be about some of the environments in the informal settlements that really affect the social networks and the capabilities of the person. So there's a lot of potential, but then I've seen how the informal settlement context can really be a bottleneck for very brilliant people who have a lot of potential. And we've seen that potential in the course of our work with Photo Voice. So one, I'm a bit more conscious about that, and in our advocacy or policy advocacy, uh, I've learned to bring out those blind spots that sometimes as policymakers or as city managers that we do not see, and uh, that really affect the day-to-day lives of these marginalized people. So yeah, it's been a period of real introspection and the reflexivity exercises that we do also really help us to address our inherent biases, or how we perceive issues. And I would say this journey has been more within as it is without, in terms of our policy advocacy and our research. Yeah. So thank you, Kim.
Thanks very much for sharing that. I think it's always really nice to hear from researchers how each project they're involved in changes their practice and their own personal perspectives. And great to hear that reflexivity has been embedded as part of your project as well. Can you give us just a practical tip on how you do that reflexivity? Is it in a group, individual? Is it written?
Yeah, so our reflexivity session, those setups are usually very safe. The first thing that we do with researchers, now I'll start with that level, is to ensure that we are all aware that whatever lessons or whatever thoughts that we share are shared in a very confidential space and also a safe space. And the first thing that we do is, before every session, we look at our values. So we speak about the values, both at individual level and the communities we come from, and how those values shape our perception of the world. So once we do that, we now talk about specific experiences when we are out conducting, our research in these communities. So people bring out what the experience is and how that relates with their values, and talk about some of the things that they were not conscious about initially, but now they are more conscious about at the moment during the reflexivity session. So that has been one way we do it with the core with among the research team. Then we've also done reflexivity with our core researchers. And how we do that is basically go through some of the research outputs, say the photos, and we ask, or may have very deep conversations with our core researchers on how that has affected, or how their values, or how that evidence relates with their values, and if there are any conflicts, and they talk about some of the things that they struggle with in the course of their work supporting our participants. So it's usually very informal conversations, but we also use a very unstructured approach to guide the conversation about our personal values, about our biases, and how that it affects our work. And I would say through some of these exercises, we're able to identify needs for psychosocial support. So, say for example, in the last few weeks, we've been working with professional counselors to do group sessions with both our researchers and also our co-researchers to identify any needs for psychosocial support. Then our trained counselors also identify needs for individual or one-on-one counseling sessions based on what came up in the group psychosocial support sessions. So yeah, that's how we've gone about our reflexivity.
Thank you so much. I've learned a lot just from listening to that process. And it's really admirable that you've built in that support for researchers so that if they do undergo any kind of moral and ethical problems during the research, they have access to support. Thank you so much for sharing that. It's been wonderful speaking with you. To end the session, do you have any advice for researchers that want to work in this way, in this participatory action research sort of paradigm?
Mm-hmm. All right. So, Kim, we learned that it's always important to go with an open mind whenever we are initiating any participatory based approach. So have a very open mind, because sometimes as researchers we may go to the community with a particular mindset or with objectives that we want to achieve. Because sometimes that is what we put into our our funding proposals. So we go sometimes as researchers, we go with a very closed mind. One of the key lessons is let's open up and let the co-researchers, the participants, and the governance actors lead the way. So our role in participatory approaches is mainly to guide the process in terms of providing technical support, because at the end of the day, our main aim is to enhance the capacity of our, of the people in the community or in the informal settlements to be able to use their voice to identify, prioritize, and develop solutions for their priority challenges. Yeah, so that has been the biggest lesson that I've learned. And again, listening is key. We need to keep listening, to what our participants are saying, to what our core researchers are saying, and that we were able to learn more through listening more. Thank you.
Wonderful advice there. And I think our listeners will get a lot from that. So, Robinson, thank you so much for being a wonderful co-host over the last 4 episodes and for taking the time to also be a guest. We've learned so much throughout the last 4 episodes in this series. So I can't wait to share it with our listeners, and I hope to see you soon. Goodbye for now.
Thank you for having me, and looking forward to engaging some more. Thank you very much, Kim.